Let's go to this discussion now. Teenage pregnancy in South Africa has reached a crisis levels with over 70,000 recorded in 2024. Recently, a 16-year-old girl from the Northwest became a mother for the second time in 2 years. On New Year's Day, a 12-year-old gave birth in the Eastern Cape, and on Christmas Day, a 13-year-old gave birth in Limpopo. The Minister in the Presidency for Women, Youth and People with Disabilities, Sindisiwe Chikunga, is now joining us for this chat. Minister, very good morning to you. Thank you so much for making time for us this morning. Where you hear about these statistics, 70,000 teenage pregnancies that have been recorded, and the story especially coming out of the Northwest, what goes through your mind?
Good morning to you and your viewers, and thank you for having us. This definitely is a concern, not only to ourselves, but I think to all South Africans, because we're not only talking about teenagers or adolescents here, but we're actually speaking about young children. We're talking about minors, who some are 10 years old, others are up to and below 16 years old, and therefore they are minors. And this therefore talks to the gender-based violence that we are seeing in our country, and of the fact that this is statutory rape, and it is therefore crime that is meted to young children who are supposed to be at school and enjoying themselves as children, but they are forced to being mothers when they are not ready to be that.
Yeah, where do you think this problem stems from, Minister, considering once again that it's been some time now since we've had that statutory rape legislation in our country?
I think this is an indication of failures in many areas of our lives. First, as families that are not able to raise our children properly and socialize them properly so that they know that they're children. But also it talks to a lack of morality among many older South Africans, because in a number of cases, the people that impregnate these children are older men, who some even tell them to lie about their ages, to say, when they ask you about the father, tell them that I'm only 17 years old, so that they may not be arrested. And these young children will therefore lie about the ages of their fathers. So it's older men again. It also, as I've indicated, highlights the impact of gender-based violence, because in many cases this will be a forced a rape or sex, but also it will even be incest for that matter, where an uncle or even a biological father impregnate a child who is as young as 10, as young as 15 years old. And to hear that a child who is 16 years old is giving birth to a child for the second time. As a matter of fact, these are the cases that we need to make follow-up on, so that these men can face the full mighty of the law, because it doesn't matter when it happened, but we can still open cases for statutory rape against those men.
Yeah, and legislation is clear around the responsibility and obligation that that lies upon, for instance, the health people in the health sector, as well as speaking about the teachers, including the adults and parents within communities. That once you know about a child who is below the age of 16, who is involved in any sexual activity, that child could be a victim of a statutory rape, and therefore there's an obligation to actually report the matter. But from the conversations that we have had with some of the authorities is that the matters are not being reported, including, for instance, this particular case coming out of the Northwest. Just a quick one, Minister. News 24 reporting that she was 14 years at the time that she gave birth the first time. The matter wasn't reported to any of the authorities. And now, once again, she's given birth again. But when the sexual activity happened, she was 15 years old.
In fact, as a matter of fact, you're so correct that anyone, even on suspicion, if you are honest about it, you have to report, even if you're not sure whether it is happening. The law is very clear on that one. Interacting with some of the professionals, for instance, health professionals, they will tell you that even if you report this, the families sometimes themselves will say, no, we don't want to go to court. But that is neither here nor there. The case has got to be reported to the police, and the police have to investigate. It is easy in an event where there is already a child, because there you have got a child, you can link the father through DNA, and therefore the father should actually face the full might of the law. It's not about the family. It's not about even the child, for that matter, the one who is pregnant. It's about the law being broken. It's about the crime being committed, that of statutory rape. And therefore, it has to become a state case, then a child himself or herself, or whoever, or the family self. It has to be a case like it is the case with murder, where when a person is dead, it is the state that will open the case, and those involved, even the family, whoever is a victim, will come as a witness. And I think it is what the Act is actually expecting, that we open cases and they become state cases, and anyone, including the child who is pregnant, will come as a witness, then probably a person who opened the case. And these things are actually not happening. And I think that is why we have to sit down as a team and as a multiple team, sitting together to say, how do we take these things forward? And that's exactly what we intend doing, to talk to the legal system, the justice system, to say when these cases get opened, it's important that they get investigated. And as far as we are concerned as the department, it definitely should not be difficult for cases such as that, these ones. It doesn't matter whether the child was born alive or not alive. It doesn't matter whether it was an abortion or a miscarriage or whatever. There is already something that can lead to linking the father to that pregnancy. And that can be done through DNA and nothing else.
Yeah. Do you think then, if there's a failure to report, whether it is the adults in the house or even the adults in the hospital, now speaking about the medical staff, that then there should be repercussions for them as well?
I think as we interact with everyone, yes, indeed, in terms of the law, there should be repercussions. It's not even about what we want, but it is in terms of the law, that if you see this happening and you don't report it, you yourself are an accomplice, and therefore you can be charged for that. So it's something that is there already in the law. It's a matter of ensuring that the law itself gets implemented by all of us. And I think it's for everyone, therefore, to remind every South African, whether as a family member, as a community member, a community leader, civil society, and of course in the public service or private service for that matter, that as you suspect and as you see it, when there is now pregnancy, it's not even about suspecting. It confirms that it has happened. Statutory rape has happened. So it cannot be that we're seeing so many statutory rapes happening in South Africa, but there are no cases that are before courts. And I really want to commend, for instance, the Premier of Limpopo, who, when she discovered that a 13-year-old was giving birth to a child, immediately she opened the case. And it's a matter of the case being opened, and then, of course, the investigations happening. What we will want to be to ensure that it doesn't happen, that as an unintended consequence of that, then these children are forced to deliver at home to hide these pregnancies, and probably families preventing them from attending antenatal clinic during their pregnancies and forcing them to deliver at home so as to hide these pregnancies. As we are aware that in some areas in one of the provinces, I will not mention, there are children that are a product of incest. They neither have documents like birth certificates, they don't go to school because they are regarded as family matters and therefore issues that should be hidden from the public. But it is the same biological fathers who are telling them that it is what is normal, and having sex with them is normal, it happens, and children believe that what their fathers are doing to them can be done. And that, for me, talks to the level within which we've deteriorated as South Africans, where a biological father sees a sex object from the daughter. And it can't happen. And that is why we as the department, but also even the Department of Social Development, were engaging even our traditional leadership, were engaging a religious leadership, were engaging the civil, working together with the civil society. We are also having on the ground the rapid response teams against gender-based violence, because indeed this is gender-based violence, to say it can't happen, things can't deteriorate to that level. That is why we welcome the involvement, for instance, of Isilo Samazulu from KZN, who leads that march, men's march against gender-based violence, because indeed this which we are discussing here today is a product of gender-based violence. Teenage pregnancy cannot be something that we're happy about. And I was actually saying yesterday to some that I was talking about, that we speak about teenage pregnancy, even for children that are 12 years old. They are not teenagers at that time. Teen is about 13, 19. So it starts from 13, 14, 15. It's teenage. That is why it's TEEN, and age at the end. And therefore, a child who is 12 years is not even a teenage. It's not even an adolescent. He's a minor, a child, and should be treated as such. But even a child who is 15 or 16, even a teenager, they're still children who must be at school, pursuing their education and their goals and dreams.
Yeah, it's a very important one, but certainly we continue to have these conversations, and hopefully at some point we are able to come up with the necessary deterrents that are required, because you're essentially robbing these children of their lives as well. But Minister, just quickly in conclusion, just another aspect that I wanted to touch on, and this is based on your previous portfolio as Minister of Transport, a conversation that we had a bit earlier on with the Automobile Association about spiking incidents happening on the country's roads. I know that you were once a victim of such an incident. But what do you think can be done to deal with this particular concern of roads being blocked, barricaded sometimes by suspects who want to rob motorists?
I think first it's crime that is being committed, and therefore the law enforcers should just be there. That's the first one. The second is the issue of smart roads. Today we speak technology, and it's possible it can be done. In fact, we've seen it in some other countries where roads are being actually monitored through technology, and therefore you will know everything that is happening on the road. But first, that is crime, and when such happen and the perpetrators are not arrested, they will therefore continue to do it. It will even be worse when it happens to people who even have, for instance, protectors and bodyguards, and no one gets arrested. It becomes a problem. But as far as I'm concerned, it's crime, and people must be arrested. They cannot every day be on the road, and everyone knows, but nothing happens. And when it happens to you, are told that that area, that is where this actually happens, the spiking of cars happens, but there is no patrolling on the road. So if we're in the absence of smart roads, the patrolling should happen, and surely the police should know and the traffic officers should know as to when these things happen, and therefore they must be on the road, and the perpetrators must be arrested, and they must face the full might of the law. But of course, smart road will also be the answers going forward.
Yeah, and in your particular case, no one has been arrested as yet.
No one has been arrested as yet, and surely you will know that in the social media, instead you get harassed that you were carrying 4 million rand. And you say, but how do you know? Because the perpetrators have not been arrested. And if I carried 4 million rand, surely it's possible that I must have been having a big suitcase to can carry that 4 million rand. From me, they took 200 rand, they took a cell phone, they took a laptop, they took 2 pairs of new shoes. There was never any money beyond the 2 million rand. And
beyond the 200 rand, you mean? There was no money beyond the 200 rand. Okay.
There was no other money beyond 200 rand. And they asked me, they said it in Zulu. They told us that it's you who has money. That's what the criminal said to me. They told us that it is you who has money. And I always wonder as to how it happened that a criminal will tell me this, and then outside it is said I had 4 million rand. There's something,
Okay.
common between that. But they also asked me to say, who is your protector? And I always say, even yourself, if you were to ask me that question, it's possible that you would say, who is your bodyguard? But those criminals, they said, who is your protector? And when they were leaving, they said, we hate police. So they knew that one, possibly I might be somebody. They didn't have time to see me because it was at night. They were able to think that I must have money. They were able to know that I'm supposed to have body protectors, not just bodyguards, but also that those are police.
Okay.
I don't know what that means. I can't explain it, but that's what happened to me. And I feel bad that they've not been arrested, those criminals.